Disclaimer: this video is for informational purposes only and is not a substitute for professional medical advice. If you have concerns or specific symptoms, always consult a doctor. Hello and welcome to Health Pills. Have you ever thought about how your body functions so harmoniously every day? Beneath the surface, complex processes are constantly at work to keep you running smoothly. There is one organ that plays a central role in this system but often goes unnoticed: the pancreas. This little-known leaf-shaped gland, hidden behind the stomach, is a true powerhouse that does much more than most people imagine. It is a silent hero that orchestrates crucial functions to enable your body to digest food, regulate blood sugar, and maintain a delicate metabolic balance. When it works well, it is almost invisible, but when something goes wrong, symptoms can be varied, unexpected, and often serious. Let's delve deeper into why you should pay attention to what your pancreas might be trying to tell you. 1. The exocrine role of the pancreas: digestion and absorption. First of all, it's important to understand that the pancreas has a dual role, functioning as both an endocrine and exocrine organ. Its exocrine function is to produce digestive enzymes that help break down food into nutrients your body can absorb. Each day, the pancreas produces about 1 to 2 liters of pancreatic juice, a complex mixture of enzymes that break down fats, proteins, and carbohydrates. To give you a clearer idea, imagine pouring the amount of soda in a large bottle every day. This is the amount of fluid the pancreas produces. These enzymes are released into the small intestine through ducts, ensuring you can absorb the nutrients you need from your diet. Without these enzymes, your digestion would be severely impaired. 2. The endocrine function: blood sugar regulation. The second role of the pancreas is endocrine, regulating blood sugar levels by producing hormones such as insulin and glucagon. Insulin allows cells to absorb glucose from the blood to produce energy, while glucagon stimulates the release of glucose from reserves when blood sugar is low. Together, these hormones ensure your body's energy supply remains stable, avoiding dangerous spikes or drops in blood sugar. If this process is disrupted, the balance of blood sugar is affected, potentially leading to conditions such as diabetes. 3. Early symptoms: persistent abdominal pain. So what happens when your pancreas starts to malfunction? One of the most noticeable early symptoms is abdominal pain. Unlike the fleeting discomfort one might feel after a heavy meal, pancreatic pain is persistent, usually located in the upper abdomen, and can radiate to the back. What makes this pain particularly distinctive is the way it presents itself depending on body position. For instance, the pain tends to worsen when lying on your back but may improve if you sit up and lean forward. This is because changing position can relieve pressure on the inflamed pancreas, offering some relief. According to a study published in Clinical Gastroenterology and Hepatology, this pattern of pain is an important diagnostic clue. In many cases, the pain may come and go over time, gradually intensifying, and may be triggered or worsened by consuming fatty meals or alcohol, making it particularly bothersome in daily life. 4. Digestive issues and steatorrhea, a warning sign. However, pain is just the tip of the iceberg. Digestive issues are often one of the first signs that something is wrong with the pancreas. Have you ever noticed that your bowel movements become greasy, oily, and difficult to flush? If so, you might be experiencing steatorrhea, a condition caused by the lack of digestive enzymes that prevents proper breakdown of fats. As a result, fat passes through the intestines undigested, leading to floating stools with a foul odor and an unusually light color. An article in the American Journal of Gastroenterology revealed that up to 90% of patients with exocrine pancreatic insufficiency experience steatorrhea. This is not just an uncomfortable change in bowel habits, it could signal serious malabsorption of nutrients, which can lead to deficiencies in essential vitamins and minerals such as vitamin D, calcium, and omega-3 fatty acids. 5. Stool color, a window into pancreatic health. The color of your stool can also be a window into your pancreatic health. Normal stools are brown due to bile released into the digestive tract. However, when stools become very light or clay-colored, it could indicate that bile is not properly reaching the intestines. This happens when there is an obstruction in the bile or pancreatic ducts, preventing bile from being secreted as part of the digestive process. A study in the World Journal of Gastrointestinal Pharmacology and Therapeutics emphasizes how crucial changes in stool color can be as indicators of pancreatic and bile duct health. Such digestive changes can easily be dismissed as a temporary intestinal problem, but if they persist, they could signal a pancreatic issue. 6. Unexplained weight loss, a red flag. Unexplained weight loss is another potential warning sign of a struggling pancreas. Losing weight without changing your diet or exercise routine may indicate that your pancreas isn't functioning properly. Without adequate enzyme production, your body struggles to break down food and absorb nutrients, leading to involuntary weight loss. A study published in the Journal of Clinical Medicine found that weight loss is a common symptom among patients with early-stage pancreatic cancer as well as those with chronic pancreatitis. While weight loss can have many causes, it is a red flag that requires attention, especially if accompanied by other symptoms like abdominal pain or digestive problems. 7. Skin itching and changes, external indicators. Your skin can also show signs of pancreatic problems. If you have ever experienced an unexplained itch, known as pruritus, that seems persistent, it could be due to a buildup of bile acids in the blood when there is an obstruction in the bile duct, often related to pancreatic issues. These bile acids accumulate and cause an intense, sometimes unbearable itching sensation. Research published in the World Journal of Hepatology found that itching is often an early sign of bile duct obstruction. Additionally, a condition called acanthosis nigricans, characterized by dark, velvety patches of skin, particularly in body folds like the neck, groin, and armpits, can also be linked to pancreatic dysfunctions. The Journal of Clinical Endocrinology and Metabolism discusses how this skin condition is associated with insulin resistance, which can be caused by pancreatic problems affecting hormone production. 8. Mood changes and mental health, an unexpected link. Mood changes and mental health shifts are not commonly associated with pancreatic issues, but they can be an important indicator. Patients with chronic pancreatitis or pancreatic cancer often experience higher levels of anxiety, depression, and irritability. The psychological impact of dealing with chronic pain and nutrient absorption problems can be debilitating, affecting both emotional well-being and quality of life. Beyond that, the pancreas plays a role in producing hormones that influence neurotransmitter function in the brain. When hormone levels are altered, they can impact mood, as demonstrated by a study published in the Journal of Pancreas, which found a significantly higher incidence of depression among patients with pancreatic diseases compared to the general population. 9. Excessive thirst, an indicator of blood sugar issues. Another key symptom that many people would not associate with the pancreas is excessive thirst, known as polydipsia. If you find yourself drinking an unusually large amount of water but still feeling thirsty, it could be a sign that something is wrong with your blood sugar levels. The pancreas' role in insulin production directly impacts how your body uses glucose. When insulin production is impaired or the body becomes resistant to insulin, glucose accumulates in the blood. The kidneys work hard to remove this excess sugar, leading to frequent urination, which in turn makes you thirsty as the body tries to replace lost fluids. This is often one of the first signs of type 2 diabetes, which is closely linked to pancreatic health. As reported in diabetes care, polydipsia is often accompanied by more frequent urination, especially at night, nocturia, and these symptoms together can be an early indication that the pancreas needs attention. 10. Persistent fatigue, an overlooked sign. Persistent fatigue is another warning sign of pancreatic problems, although it can be difficult to identify as many health conditions cause fatigue. However, fatigue related to pancreatic dysfunction tends to be overwhelming and does not improve with rest. A study published in Supportive Care in Cancer found that fatigue is one of the most commonly reported symptoms among people with pancreatic diseases. There are several reasons for this. First, poor nutrient absorption can lead to deficiencies in vitamins and minerals necessary for energy production. Secondly, chronic inflammation caused by pancreatic issues can deplete the body's energy resources, contributing to a constant feeling of exhaustion. If you feel unusually tired without an apparent cause, especially if accompanied by other symptoms such as abdominal discomfort or digestive changes, it's advisable to consult a doctor. 11. Abdominal bloating, more than simple indigestion. Abdominal bloating is another symptom that many attribute to simple indigestion or gas. However, in the context of pancreatic problems, bloating can be a sign of malabsorption. When the pancreas doesn't produce enough enzymes, food is not properly broken down, leading to fermentation in the intestines. This fermentation process produces gas, causing bloating and discomfort. According to gastroenterologists, patients with exocrine pancreatic insufficiency frequently report a feeling of fullness and bloating that can become quite uncomfortable and interfere with daily activities. 12. Breathing difficulties, a surprising symptom. Surprisingly, pancreatic problems can even affect breathing. A study published in the Chest Journal found that acute pancreatitis can lead to respiratory issues such as shortness of breath or shallow breathing. The pancreas is located near the diaphragm, and when it becomes inflamed, this inflammation can spread to the diaphragm and chest cavity, making it difficult to breathe properly. Some patients experience symptoms such as shortness of breath after eating or while lying down, as the inflammation worsens and puts pressure on surrounding organs and muscles. 13. Persistent low-grade fever, a sign of chronic inflammation. Another subtle but important symptom to be aware of is a persistent low-grade fever. Unlike a high fever that spikes rapidly and signals an acute infection, a low-grade fever related to pancreatic issues often hovers between 37.5 degrees Celsius and 38 degrees Celsius and can persist for weeks or even months. An article in the World Journal of Gastroenterology indicated that low-grade fevers could be a sign of chronic inflammation in the pancreas, such as in chronic pancreatitis or an ongoing infection in the pancreatic ducts. While it may not seem like a serious symptom on its own, when combined with other signs like pain, digestive issues, or weight loss, it can signal the need for medical evaluation. 14. Taste alterations, an overlooked symptom. Your sense of taste may also change when your pancreas is in trouble. Some patients experience a persistent metallic taste in the mouth or find that familiar foods no longer taste the same. According to a study published in the Journal of Clinical Oncology, taste alterations are a common but often overlooked symptom in patients with pancreatic cancer. The exact cause can vary. Sometimes, it is linked to substances released by a pancreatic tumor. In other cases, it may result from inflammation affecting the taste buds or nerves responsible for taste. 15. Urine color changes, an important signal. Changes in urine color can also be an early indicator of pancreatic problems. If your urine appears dark, resembling tea or cola, even when you are well hydrated, this could be due to a problem with bile flow. The pancreas and liver work closely together, and when there is an obstruction in the bile ducts, bilirubin, a byproduct of red blood cell breakdown, accumulates, causing the urine to darken. The Journal of Hepatology underscores the importance of noting these changes, as they can be a sign of pancreatic liver dysfunction, often requiring further medical investigation. 16. Jaundice, a visible symptom not to ignore. One of the most visible symptoms of pancreatic distress is jaundice, which occurs when the skin and the sclera, the whites of the eyes, take on a yellowish tint. This is caused by the accumulation of bilirubin in the blood due to a blockage in the bile ducts. Jaundice is an early common symptom of pancreatic cancer, especially when a tumor is located in the head of the pancreas and obstructs bile flow. A study published in the World Journal of Gastroenterology emphasized the importance of recognizing jaundice as a warning signal, as it often prompts patients to seek medical care, leading to early diagnosis and better treatment outcomes. 17. Keeping track of symptoms, a proactive approach. All these symptoms are like pieces of a puzzle. Each one alone may not seem like a serious problem, but together, they can paint a comprehensive picture of pancreatic health. That's why keeping track of symptoms in a diary can be incredibly useful. A study published in BMC Gastroenterology found that patients who keep a daily record of their symptoms, including changes in appetite, digestion, pain, and energy levels, are more likely to identify patterns that help doctors make a timely diagnosis. Writing down your experiences can not only bring clarity to your personal understanding of what's happening, but also be a valuable resource for your doctor. 18. Advances in early diagnosis and treatment. In recent years, advances in medical technology have greatly improved our ability to diagnose pancreatic conditions early and accurately. For example, magnetic resonance cholangiopancreatography, MRCP, provides detailed images of the pancreatic and bile ducts, helping identify obstructions, cysts, or other abnormalities. Contrast-enhanced CT scans are also highly effective at detecting small pancreatic tumors, sometimes as small as 1 centimeter in diameter. An article published in Radiology highlights how these technologies, combined with blood markers such as CA19-9, are revolutionizing the early diagnosis and treatment of pancreatic diseases. 19. Treatment options and advanced therapies. Once a pancreatic condition is diagnosed, treatment options vary based on the specific condition and its severity. For pancreatic cancer, immunotherapy, treatments that activate the patient's immune system to attack cancer cells, has shown promising results in recent studies, including one published in Nature Medicine. For chronic conditions like pancreatitis, new cell therapies are being explored to regenerate damaged pancreatic tissue. 20. Prevention and healthy lifestyle. Early diagnosis and treatment are crucial. As emphasized in a study in the Journal of Clinical Oncology, patients diagnosed with early-stage pancreatic cancer have significantly higher survival rates. Prevention is a key component in managing pancreatic health, and there are measures you can take to reduce your risk. Diet plays an essential role. Consuming a diet rich in fruits, vegetables, whole grains, and lean proteins while limiting saturated fats can support pancreatic function. Excessive alcohol consumption is one of the main causes of pancreatitis, as discussed in the journal PANCREAS, so moderating intake is important for pancreatic protection. Regular physical activity is also beneficial for maintaining a healthy weight and improving insulin sensitivity, reducing the strain on the pancreas. A study published in Diabetes Care highlighted that individuals who engage in regular exercise have a significantly lower risk of developing type 2 diabetes. 21. The future of pancreatic health, early diagnosis, and personalized therapies. Quitting smoking is another powerful preventive measure, as smoking is a well-known risk factor for pancreatic cancer, as reported by the International Journal of Cancer. The future of pancreatic health also looks brighter with promising developments in early diagnosis and personalized treatments. For example, a recent study published in Science Translational Medicine showed promising results for a saliva test that can detect early-stage pancreatic cancer. Additionally, personalized medicine is revolutionizing treatment strategies by tailoring therapies to the genetic profile of each patient, as discussed in Nature Reviews Gastroenterology and Hepatology. This individualized approach has the potential to significantly improve treatment effectiveness and patient outcomes. Conclusion: listening to your body's signals. In conclusion, your pancreas may be a silent organ in your daily life, but when it has issues, it sends signals that should not be ignored. Whether it's abdominal pain, digestive changes, unexplained weight loss, mood swings, or other symptoms, paying attention to these signs can help you identify problems early and seek timely treatment. Remember, being informed and proactive about your health is the best way to ensure a long and healthy life. Listen to your body, take care of yourself, and don't hesitate to seek medical advice. Thank you for watching Health Pills. If you found this video informative and want to learn more about how to take control of your health, don't forget to subscribe to the channel. Give this video a thumbs up and hit the notification bell to stay updated with our latest health insights. Take care and see you in the next video.